Tonight, a local expert is raising a red flag. It's not about the number of cases, but the rate of people testing positive for coronavirus.
It comes as officials keep an eye on Hampton Roads cases. In particular, Virginia Beach. The resort city currently has close to 1,400 cases with substantial increases each day. 10 on your side's Marielena Balouris has more on these concerns. Lena?
Yeah, I spoke with two local doctors who say the recent spike in cases is concerning. They say it's most likely caused by group gatherings combined with a lack of social distancing and a lack of wearing masks. Statewide, coronavirus case numbers continue to move in the right direction, but local experts warn don't get complacent because that's not the case in Hampton Roads.
So the rolling 7-day average was coming down until in Eastern Virginia until early June, and it reached as low as about 55 cases a day. But then by the end of June, it had risen to 105 cases, so almost double.
Dr. Edward Oldfield is a professor of internal medicine at EVMS and an infectious disease specialist. He believes group gatherings are contributing to the rise in cases.
Really what we're seeing is people under the age of 50 are the ones causing the spike in cases.
Dr. Demetria Lindsay, health director for Norfolk and Virginia Beach, agrees.
We are finding a pattern of significant portion of people who have been involved in some type of gathering.
She says while state numbers look good, people are not practicing preventative measures.
At the end of the day, what people do matters. It matters not only for themselves, but it matters for their families, and it matters for the community.
The number of hospitalizations remains steady in the region, which is good news, but Dr. Oldfield worries that could change.
We're going up in cases. So far, we haven't in hospitalizations, but again, that could be a lag, both in transmitting from the young to older and higher risk populations, and just a lag from when you're diagnosed to when you get sick enough to be in the hospital.
Both Dr. Lindsay and Dr. Oldfield say keeping the curve flat is key, although Dr. Oldfield says local hospitals are better prepared now than when the pandemic first hit. Still, we do not want to see those hospitals overwhelmed. In the newsroom, I'm Marielena Balouris, 10 on your side.